sucks from the community, and it can be a real pain in the butt. It's unfair, it's unfun, but that's not the stigma that matters. My name is Steve Nowotniak. I'm a licensed occupational therapist, a certified peer specialist, and I successfully live with a bipolar condition. And as I mentioned in the intro, there is a stigma out there that's associated with mental health, and it's really important that we help challenge that stigma. And that stigma is unfair. That stigma is unfun. It's much better than it was, that's for sure. You know, especially with all these videos and stop the stigma campaigns and things. And I truly believe that with the pandemic that we just went through, that has shown that mental health is something that we need to take care of, and that it's an important piece. But as I mentioned, community stigma isn't the biggest one. The biggest one that I find is self-stigma, and that's the one where you take on guilt and shame because you have a diagnosis, and that feeling of being a broken person and somehow you're less than, and that there's something fundamentally wrong with you. Those are the things with self-stigma that I find is the biggest negative influence on our ability to be successful. So there's a couple things going on as we unpack it. Number one, our symptoms, if we have a mental health condition, if we have that diagnosis, our symptoms can be very internally uncomfortable, and our behaviors and actions can be as a result of that internal discomfort. And depending on what we're doing, whether it be depression or anxiety or mania, that can have an impact on other people. That is absolutely true. And we fundamentally need to take responsibility for our behaviors and our actions. But aside from that, like this feeling of being brokenness, it's not empowering. Basically, if we strip away everything, we're human beings and we're having a human experience. And the human experience is one that has positive experiences and uncomfortable experiences. I shouldn't say positive. I should say comfortable experience and uncomfortable experiences. And then it's easy for us to label uncomfortable experiences as being bad and wrong. So the biggest thing I want to throw out there is that if you have the diagnosis, that doesn't mean that you're broken. It does mean that you can have some uncomfortable experiences, but that isn't meaning that you're broken or less than. So there's a difference between community stigma and self-stigma. Self-stigma is the biggest one that we have control over, that we can work on. And in this YouTube channel, I share about different skills and tools that I use to successfully work with my bipolar condition. I also talk about different perspectives and paradigms that I use to help frame how I feel like I'm being successful with my bipolar condition. So check out the video, subscribe in the link below, and hopefully this video helped. Take care, have a good one, and I'll talk to you later.